Okay, the applied physiology outline. You know that in the exam, you guys would write normal physiology questions and applied questions. That is the norm for your university. So we also look at the applied physiology outline, beginning with the men. That is some of the reproductive disorders that can be found in men. So the first one we want to look at is breast disorders in men. Breast disorders in what? Men. This can be physiological, as in during puberty, some men develop breasts, and that is known as gynecomastia, right? But we also have some pathological conditions that results into breast development in men. And when we are done with that, we'll look at persistent erection in men. Some men penis erect, never falling, never sleeping. It is just persistently hard. All right? So we want to look at what that is all about and their causes. So when we are done with that, we'll now have to look at scrotal pain and scrotal inflammation, that is swelling. Scrotal pain and swelling. This can be, look, scrotal pain is very painful. Very, very painful. Some men can have this, and in fact, it comes with a whole lot of discomfort. So we'll look at the pathophysiology of that. And then we'll now move to prostate disorders. This one is common among elderly men. You can see a lot of men have prostate problem. Our fathers. So we'll look at prostate disorders in men. When we are done with that, we'll now have to look at decreased libido in boys or in men. Decreased libido, decreased sexual interest. While some men have very high libido and sexual interest, some men have decreased libido. They don't have interest in meeting their spouse or their wives. So what are the causes of all of this? We'll look at that. When we are done with that, we'll also look at erectile dysfunctions, problems resulting from erection of the penis, erectile dysfunctions in men. And then going forward, we'll look at inability to ejaculate in men. Some men can have erection, but they have problems with ejaculation. So a man who has erection but cannot ejaculate when making out with a wife, of course, such couples will not have children. So we'll look at all of these ejaculatory disorders, inability to ejaculate, as well as premature ejaculation in men or boys. Premature ejaculation. This thing you call 1 minute man, 1 second man. That as soon as he just penetrates his wife, he has already released everything in his body, including his life, and he tells you he's tired. And the woman is complaining, what's going on? I'm just warming up. We've not even started and you have already reached cloud 9 when I'm still in cloud 0. This can cause a lot of issues in marriages. So these are a few things we want to look under the applied physiology, applied reproductive physiology in men. A few. There are others, but for lack of time, we may not be able to touch on all of them, but we will touch on these few. All right? But if time permits, we'll add others. Okay, that is for the men. When I go over to the women, the clinical correlates in girls. Firstly, we want to look at vaginal bleeding, vaginal itching, and vaginal discharge in girls. That is, we are looking at this both in adult women and in children. Vaginal itching, bleeding, and discharge. All right? When we are done with that, we'll look at genitopelvic pain and penetration disorders in females. Penetration disorders in what? Females. Some women undergo pain whenever their husbands are penetrating them. So they scream. I said their husbands. I didn't say their boyfriends. So their husbands. This is one of the problems we have in females. While others are enjoying, making out with their spouse or their husband, there are some who are screaming in pains, excruciating pains during makeout or sexual intercourse. So while some wives are shouting, harder baby, faster boo, yeah baby, quicker baby, some other wives are shouting, stop baby, it's paining me, stop. All right? So all of these penetration disorders are some of the things we are going to look at in this class. Then going forward, we'll also look at sexual interest and arousal disorders in females. It's just like decreased libido in men. All right? There are some women who have arousal disorders, decreased libido, and low sexual interest. Have you heard of a girl saying she's not interested in sex or she doesn't like sex? Some of these things could be as a result of some reproductive anomalies in women. They have no interest in sleeping with their husbands, and that could be a disorder. We'll look at that. Then after that, we'll look at disorders of orgasm in girls, orgasmic disorders in women. There are some women that ejaculate, but in a very abnormal satisfaction.